specifically in like a pregnancy labor
Okay.
answer. The most common, I think there's probably two most common fears. One is a little less common maybe than it used to be. Everybody used to always be terrified of pooping on the table.
Interesting.
And the second most, an incredibly common fear is a fear of tearing, vaginal tearing.
I see.
Very, very common fear. The pooping on the table thing, I'm like, listen, you are going to have a bowling ball sized thing rolling over your colon. And so poop happens. Don't be scared of it. Don't be embarrassed by it. I'm not gonna like let you sit there undignified. I like keep people covered. There's very graceful ways to care for somebody in that moment that like preserves people's dignity and doesn't make it a big deal. So like skilled birth workers should be able to do that. And like that's a thing. The tearing thing, there's all kinds of things we do in advance of labor to prevent tearing. Ways to increase blood flow, to get that relaxin hormone to the perineum, all these different things. And then in the moment of delivery, a really controlled delivery of the fetal head, counter pressure from me, all of these various things can really help mitigate the risk of tearing, especially a more extensive tear, like a 3rd or a 4th degree tear. So helping people understand that like that's also my primary focus for you. You know, I want your safety. I want the baby's safety. But like that is keeping somebody's body really intact is one of my primary focuses too. And that often will help people be less freaked out by that.
Okay. And so are there some patients who feel like scared? Like, I'm just imagining maybe not all your patients are maybe planning to get pregnant. And how do you deal with the patient who's just like, how do I even fit this into my life?
Yeah.
Right? Like, I don't want to change my life. I like my life right now, but I do want children, but like, what the heck? Like now I'm doing this thing. And
Yeah.
how do you even like, does that come into the OBGYN appointments or like?
For sure. There's a lot of labor fear that we just sort of carry, I think, as American women, because birthing in this country has become so siloed. Well, it had been very siloed, very private, very sort of almost secretive for, God, like 100 years. Birth used to be a community practice. And if Susie's in labor, we're all like all of the women would go to her house while she was in labor to help her. And it would be like, Susie's in labor, let's all go. You've got the kids, I'll boil some water, I'll go milk the cow. We're gonna be here rubbing Susie's back. Like it just used to be a thing where by the time you would have your first baby, you would have seen tens of births, 20, 30, who knows how many births, you would have seen it already. It would not be this mysterious black box of a thing that you really only get from the movies, which is now how we mostly experience birth. And so you see these movie births and TV births that are wildly unrealistic, that involve a ton, your water breaks on a city street, or you're in a cab and the cabbie is screaming at you not to mess up the seats. Like that is not how birth should be. It should be quieter. It should be dark generally. The environment should be calm. The person who's birthing should have control over their environment. So there's ways to really mitigate that fear. As to the more existential fear of like, what is this going to do to my life? There's certainly things, it doesn't come up so much in my care, but it's definitely a factor because one of the things I deal with folks a lot is how do we get enough leave for them, enough postpartum leave and, coordinating EDD and FMLA and, whatever benefits they may have from their company. So